We're talking to Russell Mitchum. Russell is 42 years old, married, and the father of 3 children. 2 years ago, he was diagnosed with bowel cancer, which had spread or metastasised to his liver. Russell was operated on, at which stage the full extent of the disease was realised. Doctors told Russell that he probably had between 6 and 18 months to live. Not surprisingly, he was devastated. Initially, he accepted the conventional medical treatment, including chemotherapy, but very quickly decided to seek other forms of medicine. 2 years down the track, Russell is still with us, and we're delighted to be able to talk to him.
I was at home one day and I went to the loo and I found blood in the stools.
Yeah?
Yeah, it was, and I just thought, oh, must have piles or something like that.
And was it just that? Did you feel any pain or?
No, I never felt any pain at all. None at all.
Okay. And apart from that, any feelings of tiredness or?
No, nothing at all. I had really no symptoms at all. I was quite active.
All right. So when did you first seek medical advice?
Well, I went and saw a doctor and I told him that I had the blood in the stools, and he had a look at me and told me that I had a few small piles.
Mm.
And I thought, oh, okay then, well, that seems reasonable to me. And I went away and left it at that, and this kept on going on for a couple of months.
And did he put you on any sort of treatment?
No, none at all. He just told me to eat more bran in the morning.
And the bran didn't do the job, obviously.
No, obviously no. I should have been eating a long time before that.
All right. So why did you persist that there was something more serious wrong with you?
Because I read a book about piles and they didn't seem to have the symptoms that I'd had.
Right.
So I went back to the doctor and he told me that I was too young, and he felt round my abdomen and he said it felt fine. And I just thought, well, this isn't any good, so I went and saw another doctor.
Right.
Yes.
Okay, and what did this doctor do?
Well, I went and saw the doctor and he told me that, he sort of looked at me as though I was a bit crazy because I'd been to another doctor and come to him and asked him, and he looked up the back of me. He couldn't really see any piles.
Mm-hmm.
And he said if it persisted for another week to come back. So I went back and saw him. I was still bleeding, and he told me that he wasn't really that good in this position.
Yeah.
It wasn't his medical expertise, and he'd rather me go and see a specialist surgeon.
And what was the outcome of seeing the specialist?
I went and saw a specialist, and he just said I didn't have piles,
yeah,
which I was absolutely amazed. And he said, we want to have a look inside of you. We'll have to knock you out and go in with a camera and have a look.
Right.
Yes.
Okay. What did the doctors tell you when you came round?
It's very bad, and that you'll definitely need surgery within a week. And I just freaked out. And I grabbed my wife and I went down the elevator and jumped in my car, which was parked around the corner, and got in and bawled my eyes out. And I was thinking, why was it me? And why wasn't it this guy? And why wasn't that guy walking down the street? Or why wasn't the guy in the elevator? Or why was it me? And I was just devastated. And I thought I was pretty tough. And when I heard that, I was crying like a baby, I can tell you.
Disbelief and an unreal sort of dream. You can't really believe this is happening to your family, your husband, your life. And the word cancer is so frightening, I think, because it just usually means death. But it's like I just wouldn't believe it. I wouldn't have the truth of what the doctors had said to my husband. This is not. I just felt no, it's not going to happen to my family.
The following day, I was booked in for a CAT scan, and I had the CAT scan, and then it started getting worse.
So, what did the CAT scan show?
Well, it was showing that the cancer that I had in the bowel had metastasised and spread to the liver on both left and right sides.
And they told you that at that stage?
Yes, my surgeon explained to me what the CAT scan had showed, and he said survival was not very good at all. I was told anywhere between the average survival rate's about 9 months. And I'm talking like 9 months from the operation, but actually good lifetime will probably only be half that time before we develop severe symptoms.
And how did you cope with the situation?
Well, the first thing I knew when I got the result on the liver, I just thought, there's no way these guys can help me. I'm going to have to do something for myself.
After his first operation, because I'm his next of kin, I really understood what next of kin means, and they told me the reality of everything. And I just cried all the time. And I had to wait probably about an hour before the doctors, were to tell Russell the bad news. So I was sort of walking around the hospital crying and holding his hand and kissing him, and I knew, but I didn't tell him because I waited until the doctors actually told him the diagnosis. So it was really, really hard. The bowel operation was successful. They cut out the tumour. They'd put a colostomy bag on him, but the cancer had spread to his liver. And one young doctor told me that my husband's liver was in such a bad state, he would die. And I just said, but how can you say that? And he just said, because I said the liver can regenerate, we can get it to regenerate. And he just said, no, there's no chance whatsoever. And I just thought, how dare you? You're wrong. You have no right. You're not God. You don't know that for sure. So it was really devastating.
I'm a father, I have a very young family, and I just thought, geez, I wouldn't mind seeing my kids grow up. And it really bothered me that something that I didn't know was telling me that I had between 0 and 18 months to live. So I sort of went crazy like every other person that's got cancer and ran around like a chook with his head cut off, trying to find as much information as I could about anyone that had survived the disease.
Where did you find that information?
I read a few books very quickly, and I contacted a few cancer organisations, and then I went on the internet and I found 3 people that had survived the disease.
People really don't know how to deal with a serious illness. Cancer just seems to be so frightening to everybody, and people don't know what to say, they don't know how to deal with it, they're frightened to ask you how things are going, and so I guess it's their own fear, but once again they're not really dealing with their own feelings, and you sort of expect a lot of support, but it just doesn't seem to be there from the family.
How significant was it finding other people who had survived cancer?
I think the amazing thing about it is that I actually found some people that had survived, and that really, really got me going. And I went from 0% to 100%, and I thought, oh, this is interesting. Actually, people do live with this disease, and I found that the people had a common denominator about how they'd lived for so long, and I'd found that out. I just asked them, 3 of them had done, and basically they'd all had the same sort of treatment. Majority of them were basically eating raw food and were eating fruit and vegetables, roughly like a vegan diet, minus animal products and dairy products.
So was it the fact that you found somebody who had survived, was that as significant perhaps as their actual stories in terms of how they'd survived?
Well, to be quite honest, it's the first time since I've had the disease and had the operation, it's the first time I'd actually had a positive input to my disease. And I just thought it was great. I just couldn't believe. I just thought, this is something that's worthwhile following. I mean, it's a lot better than what the doctors have got to offer me. And I just thought, unbelievable. Actually, somebody's out there that's living after this disease.
Do you feel that the medical profession failed to inspire the sort of hope in you that finding those cancer patients had given you?
Well, this question makes me laugh now because I would never do this, but I remember talking to the oncologist and